the really cool pieces of security research that we did at one point was called Hacking Hospitals. And what we were really interested in exploring was this question that is really understudied, like it's not studied enough, which is, could attackers hurt patients? So in healthcare, there's a lot of focus on patient privacy. And also at the same time, the most important thing in every element of that entire profession is ensuring patient safety. But to us, there seemed like a little bit of a misalignment between those two things, in that patient safety is important, but when it comes to a cybersecurity context, all the money goes to protecting patient privacy. And so we're really interested in studying that. So we set out, we did this pretty lengthy study, took about 2 years, exploring this question of whether or not attackers could hurt patients. And we found a number of ways that, in fact, that could happen. And one of the ones that really stood out, just as an example, was the way you could manipulate passive medical devices. So active medical devices are things that do something to the patient. Like an example would be a pacemaker. It actively sends signals to your heart, and it's pretty easy to understand how manipulating that would hurt a patient. But what about passive medical devices? Passive medical devices are not doing something actively to the patient, they're reacting to the patient. So an example of that would be something like the bedside monitor. Now, we've all seen that on TV shows, or maybe anytime you've been in a hospital, maybe visiting someone, or maybe yourself. And that's the device that's right next to the patient bed, and that reports on your vital signs like oxygen levels, heartbeat, etc. And we wanted to look at how could you actually hurt a patient by attacking that system. And here's what we discovered as an attack flow. So the first thing is that we discovered you could bypass authentication. So that means that someone effectively could be logged into the device without being actually logged into it. And then an attacker could perform what's called remote code execution. And that's where you can issue a command to the device and the device will react to it. And one of those commands that we could get this device to react to was to override alarms. So normally the way these work is that if a patient is having some sort of issue, let's say they're having a heart attack, well, that should signal the central nursing station. And then the nurse will come running into the room and determine what's going on and administer care. Well, what if you could override that? What if you could actually turn it off? So in the event that patient is having a heart attack, the nurse is not notified. That patient having that heart attack is going to suffer, get hurt, potentially experience a fatality. The opposite we also found is true, that you could actually trigger false alarms, which just inserts chaos into the care environment. So imagine now the patient who doesn't need that care, it's signaling to the central nursing station, it's now diverting care from other patients, and the nurses will come and if there's a potential flaw in the procedures, they might even administer, say, the electric paddles to a patient who doesn't need it. That could hurt the patient, potentially kill a patient. And so these are the types of things that we're really looking at, and which is why research matters, because this was security research. We're able to discover these issues and then advocate for how to improve those issues. So hopefully this story helps you know where to spend in healthcare with securing patient safety.